Hello, my name is Aaron Snyder, and I'll be doing a case analysis on the portrayal of Howard Hughes in the movie The Aviator, starring Leonardo DiCaprio. Howard is known for being the director of the movie Hell's Angel and his perfectionist attitude, which is widely seen as symptomatic of OCD, or obsessive compulsive disorder. The OCD Howard suffers in the film is pretty accurately portrayed. Although they never specifically state that he had OCD, it's pretty evident based on his actions. I diagnosed Howard Hughes with OCD based on the fact that he met the following criteria: obsessions and compulsions. Obsessions are defined by the DSM 5 as persistent thoughts, actions, or images a person experiences that are unwanted or intrusive and cause marked distress. Compulsions are defined as repetitions and deliberate actions that are done in excess in response to the person's obsessions. For example, somebody that may be obsessed with cleanliness, a compulsion would be done in response to that, and a compulsion would be to excessively wash your hands, which Howard Hughes did a lot throughout the film. The primary diagnosis, obviously, it was OCD, as I already stated earlier. OCD, Howard exemplified OCD based on the fact that he met the criteria of compulsions and obsessions. Compulsions, example of Howard's compulsions were that Howard had an excessive need for cameras for the movie. Although in the movie it stated he had 24 cameras, which is a relatively large amount of number of cameras to have, he at one point expressed the need to have even more cameras, which was basically a prime example of somebody who is being obsessive about something. Another example of his obsession was that Hughes had an intense phobia of germs and anything dirty, therefore, he took extreme precautions to avoid any situation that may expose him to germs. Also, another clue sort of to speak, is that Howard Hughes' mother may have been the one who contributed to the onset of his obsessive behavior, because during his childhood his mother consistently overreacted to him becoming sick. Like if he were to sneeze or sniffle, his mother would rush him to the hospital. And also another key to his obsessions were that Hughes took several years to make the movie Hell's Angel due to his perfectionism. Now, the compulsion criteria, examples of why he met the compulsion criteria, was that obviously he had a obsession for germs, but he combated that obsession for germs to avoid germs by consistently washing his hands. That's a compulsion. Also, I'm gonna just go down a list of things that he did that were compulsions, because it's pretty much too many to name, so I just had to sum it up. Um, at one point in the movie, he was seen wiping crumbs off a table and then throwing a napkin away. That's a very compulsive behavior. Um, as mentioned multiple times already, he washed his hands a lot throughout the movie. That's a compulsive behavior. Um, At one point in the movie, he was waiting to sneak out the bathroom when somebody else opened the door, because he didn't have another towel to open the door with. So basically, he waited to leave out the bathroom because he didn't have a towel to open the doorknob with, which is a very compulsive behavior. If you need a towel to open the door, that's saying something. And also, he had another man wipe a doorknob for him before, because he didn't want to touch the doorknob with his own hands. That's a very compulsive behavior. He also drank bottled milk and removed the cap with his left hand and put the top in his pocket. So let me rephrase that. He drunk milk out of bottle. He took the top off the bottle and put the top in his pocket. That's a very obsessive behavior. That's very abnormal, which met the criteria for the compulsion aspect of the diagnosis. The rule out diagnosis was that he did not have general anxiety disorder. Reason why I chose generalized anxiety disorder as the rule out diagnosis was because the DSM-5 states that the symptoms cannot be associated with another mental disorder, such as OCD. Also, the recurrent thoughts that are present in generalized anxiety disorder are usually about real life concerns, whereas Howard Hughes's obsessions were not really about real life concerns, such as him touching a doorknob and becoming contaminated. That's not a real life concern. Whereas in generalized anxiety disorder, is the obsessions or the anxiety is usually brought on by a real life or a realistic or reasonable experience, such as, let's say, I'm new to driving, me not wanting to get into an accident. That's a real life anxiety provoking situation. So that's not something that's consistent with OCD. Additionally, compulsions are apparent in the patient's case, which would not be apparent in anxiety disorder or specific phobia. Lastly, patient's fear of crowded places and public places is related to his obsession with contamination rather than a fear of the social situation itself, which is kind of harping on the point I just made earlier. When generalized anxiety disorder, the obsession or the compulsion is more so based off something that is not realistic or not something that is a reasonable worry. So that's why I use general anxiety disorder as a rule out disorder, because we can definitely ascertain that he doesn't have GAD or generalized anxiety disorder because he does not meet certain criteria. Discussion of psychopharmacological treatment. Despite the lack of definitive information regarding the value of combining treatments for medicine and behavioral therapy, many clinicians prefer combined therapies. For example, for patients who are unwilling to engage in a treatment that is anxiety provoking, medications that reduce discomfort from obsessions may enhance motivation for the desired change, which is a reduction in symptomatic behavior. For patients who are already medicated, the high probability of relapse on drug withdrawal is a good indicator for the use of behavioral therapy. Antidepressants approved by the Food and Drug Administration, better known as the FDA, to treat OCD include Enfamil for adults and children 10 years or older, Prozac for adults and children 7 years or older, fluvoxamine for adults and children 8 years or older, Paxil for adults only, Zoloft for adults and children 6 years or older. Okay. Antidepressants aren't always considered addictive, but sometimes physical dependence, which is different from addiction, can occur. So stopping treatment abruptly or missing several doses can cause withdrawal-like symptoms. This is called discontinuation syndrome. I think for Howard, due to his natural obsessive behavior, it's best to start with behavioral therapy and then ease into having him take medication so that the medication won't become his new compulsion to alleviate his OCD symptoms. For example, Howard Hughes as we seen in the movie, he's a very obsessive person. And I think if he were to realize that all he had to do was take a pill to alleviate his obsessions, that would create a new compulsion. So that was my rationalization to say, hey, let's have him ease into behavioral therapy. Let's have him start out with behavioral therapy and then ease him into the medication portion. Maybe put him on Paxil or maybe even Zoloft. Psychological treatment for Howard. I chose behavioral therapy because the main abnormalities of Howard's OCD are his behavioral habits, such as excessive hand washing or the irrational fear of touching doorknobs. The building blocks of behavioral therapy for OCD are exposure and ritual prevention, better known as ERP. ERP involves confronting a distressing situation or experience repeatedly until it no longer triggers distress, while resisting the drive to engage in problematic anxiety reducing behaviors. In the case of OCD, it is the obsessions which prompt the distress. So, in ERP for OCD, exposure to obsessions is accomplished by deliberately seeking out situations that have the power to provoke them. For example, Howard's obsession about germs could be encouraged to practice touching items that have been in public places with no compulsive washing or avoidance, something that would quickly prompt his obsessive thoughts. And then, after that task is accomplished, a new situation can be added. For example, his doorknob fear, or excuse me, his fear of touching doorknob handles with his bare hands could be the next phase of the treatment. And that could be practicing, and he keep practicing touching doorknobs until he loses the fear of doing so. And then eventually that behavior, if I had him come in 3 or 4 times a week and just work on his fears and his obsessions by work on them through exposure, I think that would alleviate the anxiety that. Lastly, I want to touch on biomedical treatment options. Biomedical therapies approach psychological disorders as having biological causes and focus on eliminating or alleviating symptoms of psychological disorder. The mind and body are viewed as connected. Poor physical health leads to poor mental health and vice versa. Although Mr. Hughes has the financial capability to participate in biomedical treatment will not necessarily be required due to the severity of possible procedures. Furthermore, Mr. Hughes' issues can be resolved without biomedical treatment. For all intents and purposes, if Mr. Hughes were to receive biomedical treatment, options such as electroconvulsive therapy, better known as electroshock therapy, and psychosurgery will be the most likely options. So, how does electrotherapy work? Electrodes are placed at precise regions on the patient's head, and through the electrodes, an electric current passes through the brain, causing a seizure that lasts generally less than 1 minute. Because the patient is under anesthesia and has taken a muscle relaxant, it is not painful to the patient, and the patient cannot feel electric impulses. 5 to 10 minutes after the procedure ends, the patient awakens, and he or she may feel groggy at first as the anesthesia wears off. But after about an hour, the patient usually is alert and can resume normal activities. Okay, and on to the psychosurgery. Psychosurgery is performed by locating the problematic region of the brain and removing or adjusting it to alleviate OCD symptoms. This concludes my case analysis of the Aviator. References can be found in the description area at the bottom of the video, or I can be reached via my NCU email. Thank you for watching and have a good day.